Most people never think twice about how they sleep. They choose whatever position feels comfortable, turn off the lights, and assume their body will take care of the rest. But what if something as simple as the way you sleep each night is quietly affecting your heart, your circulation, and even your risk of stroke? It sounds surprising, but your sleeping position can influence how blood flows through your body for hours at a time, and when you're over 60, those hours matter more than ever. Because during sleep, your body isn't just resting, your heart is still working, your blood is still moving, and your body is constantly adjusting pressure, oxygen levels, and circulation. The position you stay in for 6, 7, even 8 hours can either support that process or slowly make it harder. Now, here's where it gets interesting. Many seniors focus on diet, medication, and exercise. All important, of course, but very few ever consider that a simple nightly habit, something you've been doing the same way for decades, could be placing extra strain on your heart or affecting how efficiently blood returns from your lower body. And when blood flow becomes less efficient, especially during long periods of stillness, it can increase the risk of something many people don't even think about until it's too late: clot formation. Blood clots don't always give a warning. They can develop quietly, often in the legs, and in certain situations, they can travel to more sensitive areas of the body. That's why circulation during sleep is more important than most people realize. But here's the part that changes everything. There is one specific sleeping position that may help support better blood flow, reduce unnecessary pressure on the heart, and allow your body to function more efficiently throughout the night. It's not complicated, it doesn't require any equipment, and yet most people are never told about it. In fact, many people are unknowingly sleeping in ways that could be working against them night after night, year after year, without realizing the long-term effect it may have. So in this video, we're going to break it down in the simplest way possible. No complex medical terms, no confusion, just clear, practical insight you can actually use starting tonight. Because sometimes the smallest change in your daily routine can make the biggest difference in how your body protects itself while you sleep. Most people choose a sleeping position based on comfort, habit, or what they've been used to for years. It becomes automatic. You lie down, turn to your usual side, or rest on your back, and within minutes, your body settles into a pattern it has repeated thousands of times before. There's no second thought, no question about whether that position is helping or hurting your body, especially your heart and circulation. It simply feels normal. But what many don't realize is that during sleep, the body enters a very different state compared to when you are awake and moving. Muscles relax, movement slows down, and the body remains in one position for long, uninterrupted periods. This means that gravity, pressure points, and body alignment begin to play a much bigger role in how blood flows through your system. When you're standing or walking, your muscles help push blood back toward the heart, especially from the legs. But when you're lying still for hours, that natural assistance is reduced. Blood flow becomes more dependent on positioning, vessel openness, and how much pressure is being placed on certain parts of the body. For seniors, this becomes even more important. As we age, circulation can naturally become less efficient. Blood vessels may lose some flexibility, and the body may take longer to adjust to changes in pressure. This means that a sleeping position that once felt harmless may now influence how smoothly blood moves through the body during the night. Some positions can create subtle pressure on key areas, such as the chest, neck, or abdomen. Others may slightly restrict certain pathways, making it more difficult for blood to return efficiently to the heart. These effects are often not strong enough to cause immediate discomfort, which is why they go unnoticed. But over several hours, night after night, they can begin to affect how the body maintains balance. Another factor is alignment. The way your spine, neck, and body are positioned can influence how open or compressed certain blood vessels are. Even small shifts in angle can change how easily blood flows, especially when the body remains still for extended periods. Poor alignment can also affect breathing patterns, which in turn influences oxygen levels and overall circulation. What makes this so easy to overlook is that sleep feels passive. It doesn't feel like something that requires attention or adjustment, but in reality, it is one of the longest continuous periods where your body depends entirely on its internal systems to function smoothly. And when you begin to understand how much influence something as simple as body position can have during those hours, it starts to change the way you think about sleep, not just as rest, but as a critical window where your body either supports its own circulation or quietly works against it. As the body moves through the night, its internal systems continue working in a quiet, coordinated way that most people never notice. Breathing slows, heart rate adjusts, and blood circulation shifts depending on posture and pressure points. This is where sleeping position begins to play a more important role than it appears on the surface. Because when the body stays in one position for hours, even small differences in alignment can influence how easily blood flows through veins and arteries. When you lie flat on your back, for example, gravity distributes weight evenly, but it can also place subtle pressure on certain areas of the body, especially if there are underlying issues like stiffness, poor posture, or reduced mobility. In some cases, this may affect how efficiently blood returns from the lower body back to the heart. Over time, and particularly in older adults, this can contribute to a feeling of heaviness in the legs or mild swelling that often goes unnoticed or is considered a normal part of aging. Sleeping on the stomach, on the other hand, can create a different kind of strain. It may cause the neck to twist for long periods and can compress parts of the chest, which may slightly affect breathing patterns. When breathing becomes less efficient, oxygen levels can fluctuate, and the body may need to work a little harder to maintain balance. These changes are often subtle, but when repeated night after night, they can gradually influence how the body feels during the day. Then there is the side sleeping position, which many people find naturally comfortable. This position can support better alignment for some individuals, but even here, small details matter. The way the head is supported, the angle of the spine, and even which side you sleep on can influence circulation and pressure distribution. If the body is not properly aligned, certain blood vessels may experience mild compression, and over time, this can affect how freely blood moves through the system during rest. What's important to understand is that the body is highly responsive to positioning. Blood doesn't just flow automatically without influence. It responds to gravity, pressure, and the shape of the body at any given moment. During the day, movement helps keep circulation active, but at night, when movement is limited, the body relies more heavily on positioning to maintain that flow. For seniors, this becomes even more relevant as the elasticity of blood vessels changes and overall circulation may slow slightly with age. The body becomes more sensitive to factors that either support or restrict movement of blood. This doesn't mean that one position is dangerous by itself, but it does highlight how consistent patterns over time can have an impact. By becoming more aware of how different positions influence the body, it becomes easier to recognize why certain adjustments, even small ones, can make a meaningful difference in how the body feels and functions during those long hours of rest. What many people don't realize is that the body has its own natural rhythm for keeping blood moving efficiently, even during rest. And that rhythm depends heavily on how freely circulation can continue without obstruction. During the day, walking, stretching, and simple movements help push blood through the veins, especially from the legs back toward the heart. But at night, when the body becomes still for long periods, it relies on positioning and subtle muscle activity to maintain that same flow. If circulation slows too much, particularly in the lower parts of the body, blood can begin to pool slightly in certain areas. This doesn't always cause noticeable symptoms right away, which is why many people never think about it. But over time, reduced movement combined with less efficient blood flow can increase the likelihood of clot formation in some individuals, especially those who already have risk factors such as age, reduced mobility, or certain health conditions. Clots often form quietly, without pain or clear warning signs. They can develop in deep veins, most commonly in the legs, where blood flow may be slower during extended periods of stillness. And while not every clot leads to serious complications, the concern arises when a clot becomes mobile and travels through the bloodstream. This is why maintaining consistent, unobstructed circulation is so important, even during sleep. The body does have natural mechanisms to help prevent this. Veins contain valves that support upward blood flow, and the heart continuously pumps to keep circulation active. But these systems work best when they are supported by good positioning. When certain areas of the body are compressed for long periods, or when alignment restricts natural flow, it can place additional strain on these mechanisms. For seniors, this becomes more relevant because circulation can naturally become less efficient with age. Blood vessels may lose some of their flexibility, and the body's response to prolonged stillness may not be as strong as it once was. This doesn't mean that problems will automatically occur, but it does mean that the margin for imbalance becomes smaller. Even subtle factors, like how the legs are positioned or whether one part of the body is under continuous pressure, can influence how blood moves throughout the night. Over many hours, these small influences can add up. The body is constantly adapting, but it performs best when its natural flow is supported rather than restricted. Understanding this doesn't require fear or drastic changes. It simply brings awareness to how important uninterrupted circulation is, especially during long periods of rest, and how the way the body is positioned can either support that process or quietly make it less efficient over time. This is where one particular sleeping position begins to stand out, not because it is perfect for everyone, but because of how it naturally supports several of the body's key functions at the same time. When the body is positioned in a way that keeps the spine aligned, reduces unnecessary pressure on the chest, and allows blood to move more freely, the heart does not have to work as hard to maintain steady circulation throughout the night. For many people, this position involves lying on the side, with the body slightly supported so that the head, neck, and spine remain in a neutral line. When done correctly, this can reduce strain on the upper body and allow the lungs to expand more comfortably. Better breathing leads to more consistent oxygen levels, and this supports the heart's ability to pump efficiently without added stress. Another important detail is how this position can influence the return of blood from the lower body. When the legs are slightly bent and supported rather than tightly compressed or left in an awkward angle, it can help maintain a smoother upward flow of blood through the veins. This becomes especially helpful during long periods of stillness, when the body relies less on movement and more on positioning to keep circulation steady. The side position can also reduce certain types of pressure that may occur when lying flat on the back. In some individuals, back sleeping can place weight in a way that affects breathing patterns or creates subtle resistance in circulation. By shifting to the side, that pressure is redistributed, allowing the body to relax more naturally into the surface it is resting on. There is also a calming effect that comes with proper alignment. When the body is supported in a balanced way, muscles can release tension more easily, and the nervous system can settle into a deeper state of rest. This is important because restful sleep supports overall recovery, and when the body is fully relaxed, its internal systems can function more efficiently. It's important to understand that this is not about forcing the body into an unfamiliar or uncomfortable position. Comfort still matters, but small adjustments like using a supportive pillow, aligning the neck properly, or placing a cushion between the knees can make a noticeable difference in how the body feels and functions during the night. Over time, these adjustments can become natural, and the body begins to adapt to a position that supports both comfort and internal balance, rather than working against the body's natural processes. This approach allows those processes to function more smoothly, helping the heart and circulation maintain a steady rhythm throughout the hours of sleep. Once you understand how much your sleeping position can influence circulation and heart function, the next step is turning that awareness into simple, practical habits that fit naturally into your routine. This isn't about forcing yourself into a rigid posture or worrying every night about getting everything perfect. It's about making small adjustments that gradually help your body stay supported, relaxed, and better aligned during those long hours of rest. One of the easiest places to start is with how you set up your bed. The pillow you use plays a bigger role than most people think. If it's too high or too flat, it can push the neck out of alignment, which may affect breathing and overall comfort. A pillow that keeps your head in line with your spine allows your airway to stay more open and reduces unnecessary tension in the upper body. When breathing is smooth and natural, it supports steady oxygen flow, which the heart depends on throughout the night. Another helpful adjustment is placing a pillow between your knees if you sleep on your side. This simple step can keep your hips aligned and reduce pressure on the lower back. When the body is properly aligned from head to hips, it allows blood vessels to remain more open and reduces the chance of subtle compression that can interfere with circulation. Over time, this can make sleep feel more comfortable and less restless. The surface you sleep on also matters. A mattress that is too soft may cause the body to sink unevenly, while one that is too firm might create pressure points. The goal is to find a balance where the body is supported without being forced into unnatural positions. When the body rests evenly, it helps maintain consistent blood flow and reduces the need for the body to constantly adjust during sleep. It's also useful to pay attention to how you feel when you wake up. If you notice stiffness, numbness, or a sense of heaviness in certain areas, it can be a sign that your position during the night may need slight adjustment. These signals are the body's way of communicating that something could be improved. Small habits before sleep can also make a difference. Gentle movement, like a short walk or light stretching, can help activate circulation before you lie down. This prepares the body for rest and supports a smoother transition into stillness. Staying hydrated and avoiding very heavy meals right before bedtime can also reduce unnecessary strain on the system. Over time, these small changes begin to work together. They don't require major effort, but they create an environment where the body can function more efficiently while you sleep. And when sleep becomes more supportive instead of passive, it turns into an active part of maintaining heart health and overall circulation, quietly helping your body do what it is designed to do night after night. So, if there's one thing to remember from everything we've talked about today, it's this: your body is still working for you, even while you sleep. Every heartbeat, every breath, every movement of blood through your body continues through the night. And the position you choose can either support that process or quietly make it harder. This isn't about fear, and it's not about overthinking every detail. It's about awareness. Because something as simple as how you rest your body for a few hours each night can influence how your heart functions, how your blood flows, and how your body protects itself over time. And the best part is, this is one of the easiest things you can adjust. No expensive treatments, no complicated routines, just small, thoughtful changes that can support your body in a powerful way. You don't need to be perfect, you just need to be a little more intentional, because when you understand how your body responds to these everyday habits, you're no longer leaving your health to chance. You're making quiet, consistent choices that work in your favor. And sometimes it's those small changes, the ones no one talks about, that end up making the biggest difference in how strong, balanced, and protected your body feels over time.